Social media and plastic surgery is clearly a double-edged sword, and one of the hot buttons is live streaming of surgical procedures. This has catapulted some individuals to social media stardom, yet many contend it's a terrible or even an unethical idea. In today's episode, we'll get to the truth about social media live streaming of plastic surgery procedures.
This is a good topic to discuss. I mean, a topic that was sent to us about an Ohio plastic surgeon that actually has been sanctioned because of live streaming surgery in facility. And I think that it does bring up a lot of points about not only, should we be doing it? Is it something that is considered to be okay to do? I think live streaming anything has its ups and downs. I mean, we're educational experts. We do live streaming surgery educationally all the time. But I think it's different in the social media arena. And that is where I think it gets a little blurred lines.
Imagine that, social media there's blurred lines with social media.
Yeah.
But yeah, I think it's a big blurred line with the live streaming. And this is again something we didn't see any of this 20 years ago.
No.
There was live surgery for educational meetings like you talked about, Rod, but for education, live surgical procedures and the filming of those has been integral to educate surgeons all around the world.
In fact, that's how millennials learn today.
Yep.
Nobody reads, so what do? You see live
Yep.
surgery, or
Yep.
you see edited live surgery.
What actually is really interesting is what goes on behind the scenes of the educational meetings. And I remember one time, one of the chief residents who were always assigned to pick up the expert surgeons, and we had one person from Australia and another person from Ohio, and somehow the chief resident overslept. He actually overslept. It was an honest mistake, but he forgot. The guys didn't get picked up, and they were mad, and then you weren't too happy at the resident, and it actually it's a legend now, and people still talk about that. But it's very, very different from live streaming a procedure on Snapchat. When we go to Baker Gordon and we're doing live surgery, how many there's support people around, versus one guy or girl on Snapchat trying to entertain their live audience while they're trying to do the surgery.
Right.
Totally different.
And I think you hit on something good. It's, we're educating and we're not really entertaining. I mean, when I'm doing live surgery, we're educating.
Yeah. Well, I think it's all about the audience, because that audience at the educational meetings is there to be educated about how they can better deliver that procedure to their own patients. Whereas in social media, there's some people that want to be educated, but there's also some people, or a lot of people, that just want to be entertained.
Right.
And so it's a totally different thing. This is not, it's not a movie. It's a surgical procedure.
Well, I think the take-home message is, be careful. I think just what is the goal of what you're going to do? Is it education? Is it entertainment? I think it's hard to put the two together in live surgery because, you're really concerned about the patient's outcome, patient's safety. And I think that's really where it kind of all comes to not a blurred line, but a straight line.
Really interesting topic, Rod. And if you didn't think this was crazy enough, you're not going to want to miss our video on a surgeon doing a Zoom call while he's operating.